a multi-speciality hospital. It provides a comprehensive medical service in Dubai, and I've been working for more than 10 years with this organization, and we provide the care and the management from birth to adolescence, and we have advanced neonatal intensive care with modern ventilator, taking care of preterm babies, and we have 24 hours the pediatric services offering the care to all the pediatric cases. See, the ARI is the leading cause of childhood mortality and morbidity in developing countries and also in developed countries. ARI is responsible for 3.9 million deaths worldwide, and out of that 90% of the deaths in ARI due to bacterial pneumonias. Our challenge in the management of ARI is the early detection of pneumonia and prevent the morbidity and mortality. And most important challenging task here is how to make the parents to understand that it is a pneumonia, and how to make each and every health worker how to detect pneumonia, and how to bring about a unified approach in the management of ARI. That is a challenge. The immunization has come as a great breakthrough in the management of ARI. With the availability of Hib vaccination, the pneumococcal vaccines, the flu vaccine, and RSV vaccine, and that's a great breakthrough in the management of acute respiratory infection. Another breakthrough can be an early detection of the pneumonia, and that only by early detection will be preventing the morbidity and mortality. And also it involves the management of tonsillitis, streptococcal tonsillitis, and prevention of rheumatic heart disease, and detection and management of otitis media and prevention of deafness. They all come under as a great breakthrough in the management of acute respiratory infection. Here, what is happening in UAE is the experts from all over the world, they gather here, they practice here. There is no unified approach. The unified approach, by giving them, educating them about ARI management, we can bring a great breakthrough in the management of acute respiratory infection in Dubai. Once again, the vaccination is most important. Whatever the vaccines are available, they should be 100% utilized. One is the best way to prevent acute respiratory infection and bacterial pneumonias. The second, I already told you, universalization of ARI management program. It has been practiced in developing countries and developed countries. And by that, we can prevent the morbidity and mortality and can bring about the unified approach. in pediatrics for the past 40 years. From 1986 to 2004, I worked in Saudi Arabia. I was associated with ARI management program. I was the regional coordinator there, practicing this training program. And this ARI management training program not only exists in Saudi Arabia, it exists in developed countries and also in developing countries. And more so in the developing countries it has been. And this management program, we were doing it since 1986. With this management program, every health worker, every practicing physician, every practicing pediatrician were told about ARI management. In this ARI management, they are taught what are the causes of ARI, how to detect ARI. I will give a simple example of detection of pneumonia. If I give a message to the parents saying that if a child is less than 2 months, if the respiratory rate is more than 60, it is suggestive of chest infection, please bring the child to the hospital. If the child is between 2 months to 1 year, if the respiratory rate is more than 50, it speaks of infection, bring to the hospital. If the respiratory rate, in case of child from 1 year to 5 years, if the respiratory rate is more than 40, it speaks of infection, bring to the hospital. If the child is more than 5 years, if the respiratory is more than 30, bring the hospital. It's a simple message. Even any health worker can pick it up, keep it up and apply. What is happens as a result of so much advance in the technology and availability of so many tools, nobody counts the respiratory rate. This is just one of the simple way to say that how the ARI program is so simple and conveys the message. And that I'm going to talk on in the speech. My talk is mainly about acute respiratory infection management program, which I used to do it in Saudi Arabia, and which I've been practicing now, and I would like to bring it to all the audience so that they can practice it, they can teach it to their juniors. See, in medicine, there is no end to the learning. Every day, there are new things come up. You cannot practice medicine by sitting without reading, without talking to the people, without attending the conferences, without reading the journals. So this is an opportunity to understand the recent topics. And it is an opportunity to convey your message and discuss with all the learned people about the efficacy of your knowledge. So these conferences are very important in developing and improving the medical practice.